you are looking at an image of the lower respiratory system. And so you may have heard of, oh, like I have an upper respiratory tract infection or a lower respiratory tract infection. Well, that's basically just saying like the part of the respiratory system that's in the head versus like the throat and the chest. And what you're looking at here would be in the throat and chest. So there's actually 3 different structures that we can see in this image. Up here, we have the larynx, or commonly called the voice box. Then this long, narrow tube right here is the trachea, or commonly called the windpipe. And then it's going to split and become what's known as the bronchial tree. And our goal today is to focus on this center one. And at first glance, you're like, that looks ridiculously simple. But let me just say, as simple as it may be, its importance cannot be overstated, because I love breathing. It's one of my favorite things. I've been doing it my whole life. I plan on doing it for the rest of my life. And this thing never takes a break. It is always open, needs to be open, because the second that it isn't, you notice, because you're in trouble. So to learn about the trachea today, we are going to be using a 100% free Kenhub article that we've gone ahead and left a link down the description below. I encourage you to check it out. You can follow along with us, and you can see that our articles are built like an encyclopedia. It will tell you everything you possibly need to know, but I'm going to fill in some of the really cool stuff, some of the really interesting stuff that I always find my students enjoy when I'm teaching about this in the classroom. So, all right, so looking at the trachea, I do want to briefly mention, so what you are looking at here is a lot of cartilage, right? Cartilage is structural in the same way, or can be structural in the same way that bone is. It's just meant to be more flexible. And I want you to just think about this, right? So this is the larynx. This is called the thyroid cartilage. And then below it, you have the cricoid cartilage. And then we're going to see that you have all these cartilaginous rings, and that's going to continue down into the bronchial tree. I want you to think about this. Why not make it bone? There's a really interesting question to think about at first, because I want you to imagine this, like the airway, like I mentioned, has to always be open. It can never be closed, because if it is closed, you are not able to breathe. So in my mind, it seems like bone would be the best choice, because then it never collapse. Now, I mean, you could make the argument, okay, well, you also don't want it to break. Can you imagine if you broke your trachea and like get fractures of bone that are going to be going into your airway? Obviously, that's not good. I do believe that is one viable answer. Another one, though, I want you to understand is that, again, it's about flexibility. Having flexibility in your respiratory system is going to be essential for, well, I mean, let's be honest, coughing, expiration, forcefully getting things out, forcefully breathing things in, right? Or the air in. So that flexibility is absolutely important. It's not just about keeping an open airway. It's about having the ability to kind of close it a little bit and open it and dilate it a little bit more. Those things are going to be equally as important. So that's why I would say we want to be aware that it's made of cartilage. Now, the type of cartilage is called hyaline cartilage, and hyaline cartilage is the most common type in the human body. You see this, so I will just let you know, even though this is the larynx, the thyroid, cricoid cartilage, all of these rings here, these are called tracheal rings. These tracheal rings are all made of hyaline cartilage, and so is your nose. I mean, hyaline cartilage is on the ends of all the long bones in your body. Hyaline cartilage is very, 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 very common. All right. So, but the thing is, they actually don't make a full circle. In reality, they only go about, they make the letter C, or maybe sometimes you could even say a D. So in fact, to show you this, I'm going to scroll down here. And what we're going to do is we're going to look at this atlas image here. This is a cross section in the cervical region. And we can tell that because you can look at this vertebra here, and it just has that characteristic cervical look to it. You can see the spinal cord, spinal nerves, all that, but we're not focused on that. Our focus is going to be right here. You see this? Highlighted in green, this is the trachea. And I want you to take note of its shape. Its shape, so you can see it has this C shape, or why I was mentioning also sometimes described as a D shape, is because the trachea is more of a D, but the tracheal rings are the C. Because what you're seeing here, that I'm kind of using, moving the cursor over, that is the hyaline cartilage. In the back is going to be a membrane. It's going to contain muscle. It's going to be something called the trachealis, which is smooth muscle, meaning it's involuntary. And so the reason why you want to have it in this position and then have, or this shape and then have muscle behind it, is because as the muscle contracts, it can start to bend these rings. And that's going to be very, very important to help kind of like just compress the airway. It's going to help with expiration. Just think like, right, as you're coughing, like quite literally your whole trachea is just, right, like whenever I'm teaching this to students, a lot of times they're just not aware of that coughing is more than just the muscles on the outside. Quite, like, your entire respiratory system is compressing in order to help forcefully expire that air. So this is going to be the shape of the trachea. But let's go right back up here. And because besides the cartilaginous rings, in between the rings, you're also going to see connective tissue. And we can see that these are called the annular ligaments. Annular ligaments gets its name because of annual, meaning circular, right? And so these are going to be going around. Now they're going to be connecting with the membrane on the back, but these are going to be basically there to help keep these rings connected to each other. But also it's going to allow for flexibility as they're moving during coughing, during breathing and expansion, those types of things. So the annular ligaments are there to help keep and maintain the structure as well, but also adding to that flexibility, just keeping it all together. Now, I will say that up top here, there is a specific ligament, right? This is the cricotracheal ligament, and it's what connects the cricoid cartilage here to the first tracheal ring. And this is actually a great spot to do what's called a tracheotomy or a tracheostomy. That would be clinically relevant, where you're bypassing the airway. You're actually just going to go in and you cut an incision in here, and you can flap this over, you can insert tubing, and then you can perform that tracheostomy. And then you can see up here, there's another ligament up here. This is called the cricothyroid ligament. And the cricothyroid ligament is another option for a potential tracheotomy. Although it's not as good as if you were to cut open right here, but that is another avenue. Now, as we go down, I do want to let you see that there's like this spot, which I've always thought kind of looks like, I'm going to be real with you, I've always thought it looked like underwear. That's just what I've always thought. This right here is the tracheal bifurcation, right? So basically what's happening is it's splitting, right? We're splitting into what's known as the left and the right main bronchi, or bronchus, or principal bronchi, primary bronchi. Right? There's so many different names for it, but you can see that we're splitting. And so you can see there's this tracheal, it's not, because it's not a ring, right? This is the bifurcation, but at the same time, there's this other little spot down here that if we come over, you can see it's called the carina, right? So this is the carina of the trachea, and this is actually going to be, really part of, it's essential to coughing, right? This is going to help with the whole coughing reflex. There's just, we're not going to get into the exact mechanics of it. Just understand the carina is actually clinically relevant if you're trying to discern maybe coughing disorders or like chronic coughing or all sorts of those types of things. But that is just going to be this most inferior aspect of this tracheal bifurcation, where it's splitting into the different bronchi. And then on the inside, which we can't really see from this view, but I'm going to go right here. On the inside, I do want to mention that the type of epithelium that's going to be lining this is what's called pseudostratified columnar epithelium with cilia. It's a mouthful, right? Which basically, these are just going to be we don't have to go into the exact histological nuances of it, but the ciliated part is really fascinating. Because if you recall, cilia are these appendages that kind of like flutter and pulsate. And what they'll do is move substances across the surface of the cell. Well, what these cilia can do inside of the trachea is help move substances up. And you're like, well, what substances are these? Well, it's mucus. That's right, because if we go back up here, there's mucus that is going to be lining all of this, right? Inside of the bronchial tree, inside of, even going further down into we'll just say the bronchial tree. Let's just keep it simple. I want you to think about this. Like, mucus is actually going to be very helpful at humidifying right? The air that's going to be going into the lungs, as well as capturing potential invaders. And so if you think about it from an infectious standpoint, if you're having an infection, let's say you want to get rid of the infection and it's trapped in the mucus, this can start to compress, push it up, hits that carina, the carina kind of hits that reflex, and you're just and what can happen as you're coughing and the cilia inside of on top of the epithelium are helping to move and propel and move that mucus up, that's where you can get that phlegm that in the mornings, I'm sorry for how graphic this is, you're just like then, and you spit it out. And there you go. Yeah, next time you have phlegm, just know it's coming from your lungs, and you can thank the ciliated epithelium for moving it through and then kind of coughing it up your trachea. But so this is the trachea. Again, it's a simple tube, right? It's just cartilage and ligaments and epithelium, and it has smooth muscle there to help compress, and it's just all about maintaining that open airway, but it can be flexible. That is the trachea. Super, super simple. Remember, this is all 100% free. Everything I am showing you here is 100% free, and we're going to go ahead and leave a link down the description below for you to check out this article, as well as just the rest of the Kenhub platform. Now, I will say the quizzes that we embed inside of the articles are a premium feature, but I strongly encourage you to check these out. They are very much worth their weight in gold, which that doesn't even make sense. It's a digital thing, but you understand what I'm trying to say. And then you can also see at the bottom, we like to actually add some clinical relevance or some case studies or things that you can kind of like sink your teeth into and just think about the anatomy clinically. Anyways, I hope you enjoyed today's video. I hope you learned something cool about the trachea. If you want to go ahead and like this video, that would be very helpful. We're always appreciative. Leave us a comment. Let us know what you thought of the video. If you have any questions, comments, concerns, you name it. But thanks for hanging out with me, and I will see you in the next one.